You may be arriving at the Medicare eligible age soon and starting to think about what exactly is Medicare? When do I sign up for Medicare? How do I sign up for it? Is Medicare all that I need for health insurance? If so, I hope this short video helps answer some of those questions and gives you just a little better understanding of Medicare. Hello, I'm Rob Gullett, one of the founders here at Medicare Basic, an independent insurance agency dedicated to helping folks find Medicare-related health insurance products. As you may already know, Medicare is a federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, permanent kidney failure requiring dialysis or transplant, sometimes called ESRD. If you've worked over the years and had taxes taken out of your paycheck, like most of us have, you've contributed to Medicare. Medicare is not to be confused with Medicaid, which is an assistance program that serves low-income people of every age. And yes, some folks do receive both Medicare and Medicaid at the same time. Now back to Medicare. Original Medicare is comprised of Part A hospital or inpatient coverage and Part B medical or outpatient coverage. Prescription drugs are covered through Part D drug coverage. There is also a Part C, which is an alternative way to receive Parts A and B. Usually D also, but we'll touch on that in a moment. Is Medicare free? This is a common misconception, but no, it is not. Although most people receive Part A hospital coverage for $0 per month, there is still the Part A deductible and coinsurance to consider, as well as premiums, deductibles, copays, and coinsurance for Part B and D. Even with that said, Medicare offers a lot of benefits, and most folks think it's a great value. When should you sign up for Medicare? You will have one 7-month initial enrollment period to sign up for Part A and or Part B Medicare. This period begins 3 months before your birth date, actually your birth month, when you turn 65, includes your birth month, and ends 3 months after your birth month. Medicare strongly suggests that you sign up for Part A and B during the 3 months prior to your 65th birth month to avoid delays and even a gap in your coverage. So if you're turning 65 in the next year or two, now's the time to learn about Medicare and all the options that you'll have. So what if you're still working and have employer-sponsored health insurance when you turn 65? Most people should enroll in Medicare Part A when they turn 65, even if they have health insurance from an employer. This is because most people paid Medicare taxes while they worked and therefore do not pay a monthly premium for Part A. You should always contact your employer or union benefits administrator before delaying Medicare to find out how your insurance works with Medicare. Also, your employer coverage may require that you enroll in Medicare in order to get full coverage, especially if your employer has less than 20 employees. Signing up for Medicare is something that you'll want to pay close attention to, as getting it wrong could result in gaps in coverage and late enrollment penalties that never go away. There's more information on this subject on our website under the FAQ tab under Medicare. Okay, how do you sign up for Medicare? The Medicare sign-up process is handled by the Social Security Administration, and you can get that information under our FAQ sub-tab of our website. As I mentioned a moment ago, there are 4 parts of Medicare, which in itself can be a little confusing. There's Medicare Part A, or hospital insurance, which covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. There's Medicare Part B, or medical insurance, which covers certain doctor's services, outpatient care, medical supplies, and preventative services. There's also Medicare Part D, or prescription drug coverage, which helps cover the cost of prescription drugs, including many recommended shots or vaccines. Unlike original Medicare, Parts A and B, Part D plans are run by private insurance companies, but the funding comes mostly from the government, which makes most plans a great value for the consumer. Okay, now you're saying, is there a Part C, and if so, why did you skip it? Well, there is a Part C, and that's where it can be a little confusing, as I mentioned earlier. Part C Medicare is comprised of government-approved health insurance plans offered by private insurance companies. You've probably seen plenty of TV ads for these plans, especially in the latter part of the year. Medicare Advantage plans provide an alternative to original Medicare. These bundled plans include Medicare Part A hospital insurance, Medicare Part B, medical insurance, and usually but not always, Medicare drug coverage, Part D. Unlike original Medicare, which is run by the government with standardized cost and coverage nationwide, Medicare Advantage plans are offered by private insurance companies and can vary in cost and coverage from region to region and even county to county. And it's for these reasons we only discuss the very basics of Medicare Advantage and focus on original Medicare and Medicare supplemental insurance here at Medicare Basic. However, if it looks like a Medicare Advantage plan works best for you and your needs, we will certainly be glad to help you with that also. So with that said, back to original Medicare, Parts A and B. Original Medicare is run and administered by the federal government. Medicare costs are standardized. Although they do change from year to year, you can see a breakdown of these costs under our website's Medicare tab in the main menu. Once again, Medicare pays for a lot, but it doesn't cover everything 100% for covered services and supplies. You can see that you'll be responsible for deductibles and 20% coinsurances on many items. These costs can result in tens of thousands of dollars, which you will be responsible for if and when you require serious medical services. Since there is no cap or maximum out of pocket for medically related expenses while on original Medicare, most folks pick up a Medicare supplement or Medicare supplement insurance plan to help pay for what Medicare doesn't. Medicare supplement insurance helps to fill the gaps for Medicare, and for that reason, it's commonly referred to as Medigap. Even though Medigap plans are sold by private insurance companies, the plans are standardized in coverage. That is, Plan G, sold by ABC Insurance Company, will have the exact same benefits as Plan G, sold by XYZ Company. However, the pricing can fluctuate greatly depending on factors such as which company is selling the plan or where the customer resides, things like that. That's why it's so important to have choices when shopping Medigap plans. As an independent insurance agency, we can help you find a plan that fits your needs and budget. Please take a look at our side-by-side comparison table found under the Medigap tab on our website's main menu. The two most popular plans among Medigap customers at this point in time are Plan G and Plan N, based on benefit, coverage, and price. So pay particular attention to those two plans. Now let's talk about Medicare Part D, prescription drug coverage, just for a minute. Most folks, when turning 65 and signing up for Medicare, also pick up a standalone Part D drug plan. These plans are sold by private insurance companies, just like the Medigap plans are. According to the Kaiser Family Foundation, the average Medicare beneficiary will have a choice of 30 standalone drug plans in the year 2021, not to mention 27 Medicare Advantage plans that contain built-in drug coverage, also known as MAPDs. That can seem a little overwhelming, but we'll be glad to help you find a drug plan that works best for you. Well, I hope this video has been informative and has answered at least some very basic questions about Medicare. If you or someone you know will become Medicare eligible soon, please don't hesitate to call us at the number above so we can help you make those very important decisions concerning Medicare-related health insurance. Until next time, my friends, many blessings.